Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. Today's program is on fibromyalgia. This is a long-awaited program for potential patients like yourself and the viewing public who wants to know more about this chronic disease and disorder that's affecting thousands of people, and seemingly there's no end to it. So tonight we're going to demystify what this condition is, and we're going to show you what you can do so that you don't have to live with the chronic pain associated with this condition, and make yourself better and healthier conservatively without the need for much or any medication whatsoever. Fibromyalgia is a connective tissue disorder influencing the muscles of the body. This condition can be caused by numerous different things. It can be caused post-traumatically, meaning you have an injury to the neck or to the back or some other muscle region of the body, and then as it heals and may not heal incorrectly, the over-response to that healing brings a lot of scar tissue formation, and this is what we call fibromyalgia, tissue in the muscle tissue itself. The other things that may cause this condition could be an autoimmune disorder, which can create an inflammation within the muscles, which then creates a generalized form of fibrous tissue inside the muscle itself. The other, and one of the more common things, especially in the central New Jersey region, is post-Lyme's disease sequela, meaning a person suffers from Lyme's disease and develops fibromyalgia afterwards. Now, keep in mind, a lot of doctors don't know too much about this condition, and the term fibromyalgia is frequently an overdiagnosed and a misdiagnosed condition. Myalgia or myofasciitis are just generalized inflammatory responses of the muscle. Fibromyalgia is when we have that fibrous tissue buildup in the muscle tissue itself. Now here we have the muscles. The muscles move, you extend and you contract, and they go through their range of motion, giving mechanical leverage and movement to the body. Once we have scar tissue formation forming within the muscles themselves, normal motion then creates an inflammatory response. So then we can have a friction building up inside of the muscles. That friction then turns into an inflammation. That inflammation then creates swelling and pain of the surrounding tissue. And then we have an endless cycle. We can see a lot of more fibromyalgia developing because the nature of the work we're doing now is what I call holding patterns. I could bend over and go like this all day and not run into too much problems. I come and hold like this, and all of a sudden in about a minute I'll start to shake. And the reason for that is that I have a constant facilitation, or meaning overworking of the muscles of the body. So what happens is that there's no longer an exchange of the nutrients in and out of there. And this is very common through bad posture at work, we're sitting in front of a computer for a long duration of time, we're focused and centered without getting up for protracted periods of time. This allows for these areas to get tighter and tighter and tighter to the point in which we're like, man, we're getting it in here. You're getting radiculopathy and radiating pain into the arms, neck pain. Fibromyalgia can occur in many different regions of the body. Predominantly, the back, mid-spine, low back, neck, and upper extremities are the most commonly influenced areas. Let's take a moment out and look at my little handy pocket chart right here. And we have trigger points. What these are, these highlighted areas are regions in which these are common areas where fibromyalgia would take place in the body. And these X's are trigger points. These are actual points of pinpoint pain response areas where when we actually activate or apply pressure to these reproduce a radiating pain. Characteristically with fibromyalgia, it's not just tender in a point, but it will radiate or spread that pain throughout a given region of the body. So these colored areas are frequent areas that are involved in fibromyalgia. Here we're taking a look at our trigger points chart number 2, and we can also see that it not only affects the back and into the buttock areas, but we can also see it commonly influences the areas of the upper extremities. Because of these patterns of tightness and tension, we're moving our fingers a lot, working with the mouse all day long, all of these things, these tension areas create not only tendinitis and joint inflammation, but then make the muscles continue to foreshorten and foreshorten and foreshorten until once again the tendency towards this fibrous muscle tissue buildup occurs. It occurs in the lower extremities, usually as a result of not stretching. So some things that we're going to go over is we've already now understand that this condition can be caused post-traumatically. It can be caused ergonomically, dealing with the nature of what you do for a living. It can be due from an autoimmune response, dealing with some type of inflammatory response in the body. It can also be associated with an arthritis or an arthralgia. So this inflammation starts to spread to the surrounding muscle tissue. Commonly, people have this condition, and they're taking over-the-counter anti-inflammatories, or they go to the rheumatologist, and the rheumatologist gives them muscle relaxers and things like that. I have nothing against the short-term use of these forms of treatment, but it's not really the answer nor the solution to your condition. What we do need to understand is that we're going to go over some structured forms of treatment that by far are the most effective, not only cost-effective, but the most effective way of getting the results that you're looking for to get better. Now, a lot of times people that have the condition, oh, if you just stretch and exercise, you're going to feel better. The problem, which we're going to go over shortly, is that when this fibrous muscle adhesions get in the muscle tissue, and then when the person overstretches or does too much physical activity, what happens is that then it starts that inflammatory response again because the muscle has foreshortened. What we need to do is release the muscle, then create the stretching so that we can gradually start to break up that fibrous tissue. It is absolutely necessary that we work through the painful areas that you're experiencing so that you can be rewarded by getting the relief that you're looking for. If you don't do what we're going to say, what happens is that between today and tomorrow, not much bad is going to happen to you and this condition. But if you let it go, gradually you get decreased range of motion more and more and more. And then it doesn't take that much for the inflammation or the pain to be triggered off through normal routine activities. And then the condition gets worse and worse. So we're going to take the remedial steps right now. So stay tuned. With me here today is the knowledgeable and illustrious Dr. Kenneth M. Kirsten. Dr. Kirsten, welcome back onto the show.
Thank you.
And my entrustulated assistant, Julaine Crooks, who is a nursing student at Texas Southern University. Thank you for coming today, Julaine, and being our assistant. Dr. Kirsten, fibromyalgia. Let's take it away.
Okay, as you so finally explained in the beginning, the fibromyalgia can be a very prominent condition affecting many, many people. One of the most common effects is what we call idiopathic, which means we really don't know how it gets there. Okay, we don't know how the condition arrived, besides the other conditions and things that would lead to those conditions. So basically, when we see a patient that comes in with chronic pain, we always do a complete history and a physical exam. Now, a lot of times when people come to us already, they say they have fibromyalgia. And like Dr. Golding said before, most of the time fibromyalgia is overdiagnosed. And the reason it's overdiagnosed is because we call it a trash diagnosis. When we can't explain things or say, oh, well, the patient has a lot of pain, they must have fibromyalgia. Or they attribute it to being psychosomatic, or a patient not having any pain physically, but actually thinking they have pain. And that's when people come in and they're very frustrated. When these people actually really do have an organic, legitimate type of myofascial pain syndrome that they can't function. So what we need to do is we go through a complete detailed history and examination. And the diagnosis of fibromyalgia is truly what we call a clinical diagnosis, because that means we find that through history and examination, because there is no specific test, no lab work, no blood work, Nothing specifically that says, okay, this equals fibromyalgia. There's many things that are associated with fibromyalgia, and I'm going to go through that right now. So after detailed history and examination, we look at the patient and finding out that actually they have the absence of condition, which means that really we've ruled out an active condition, such as rheumatoid arthritis, which would be an active inflammatory condition that's going to affect the joints, true osteoarthritis, mixed connective tissue disorders, systemic lupus, things of this nature, so significant conditions that will be treated with medication, steroids, and things of that nature. So now that we've ruled out all these things, and the patient comes back and they have negative blood work and all these things, they have a negative rheumatoid factor, they have a negative ANA, they have all these negative tests, and they're like at a loss. They don't know what to do. That's when I'm starting to think about fibromyalgia. Now, the clinical examination, this is the most important part. We do an examination, we evaluate the patient neurologically, ranges of motion, and I find tender points on people. Now, a lot of times, like Dr. Golding explained it before, we find multiple tender points on people. Fibromyalgia is pretty specific. It's extremely tender. It's extreme tenderness in these areas. I mean, barely touching the patient, they would start to wince and feel pain. So I know that we're onto something. We're going to look at actually 18 specific points, or 9 pairs of what we call those trigger points before, tender points, points of significant tenderness and pain. So Jelaine, you're going to come sit right here on the side here. The first thing I'm going to look at is in the back of the head and the neck here. First 2 pairs of points, or pair of points right here is up, and we call the suboccipital muscles. Right up here, we're going to see a lot of tenderness right here. Then we're going to drop down, and we're going to come up to mid-trapezius muscles. We're going to come right about in here, and we're going to find points along these lines right here. Then we're going to drop down and find specific points right here into what we call the rhomboid muscles, the levator scap muscles, right in here. Then you're going to lie back down here. We're going to find 2 more points right here in the front of the neck, what we call the scalene muscles. They're going to come right and run right on top of the collarbone. You're going to feel extreme tenderness here. Then we're going to drop down right into the sternum, right in here in the chest, in the pectoralis major muscle. Right here, we're going to find 2 more points right here. And then we're going to find points in the extremities, like Dr. Golding was saying before. We're going to find points right here in the anterior elbow, and right here, right on like what we call tennis elbow, extreme tenderness right in through here on both sides. And then we're going to find points right on top of the kneecaps, right inside of the knees, right in these muscles in the quadricep muscles right here. And then you're going to turn on your stomach for me, Jelaine. And the last 2 points we're going to find right over the sacroiliac joints, right above the hip line right here. 2 points right here. And then we're going to find 2 more points right underneath, like the crease of the buttock right here, right at the top of the hamstrings, right here. Now, when I hit those specific points and I find these 18 trigger points above and below the waist, the absence of positive testing, that will help me confirm or really be convinced that this patient truly exhibits a fibromyalgia condition. Okay, you can sit up for me now. So now, what do we do with it? You can swing your legs around there. We're going to talk about treatment and what we can do to help these people, because these people are very frustrated, they're tired, they're fatigued, they don't know what to do. Basically, what we need to do is release those trigger points. We need to release those trigger points through various techniques, which we're going to get into. But basically, like Dr. Golding explained before, they have these significant fibrous tissue in there, and we need to get them to be stretched and relaxed, and to get rid of those antioxidants, get rid of those free radicals or those tender points in that muscle, and get some oxygenation in these muscles and get some circulation going again, because people that exhibit this condition, they don't want to move. And that's the problem. When they don't move, that's how things begin to get worse and worse. And that can lead to arthritis and osteoarthritis and these other bad conditions, cervical radiculopathy, pinched nerves, things of that nature. So chiropractic is one of the first things we're going to do. Chiropractic is going to be a manipulation to the spine, stretching, mobilization to these areas, the neck, the sacroiliac joints, stretching the hamstrings out, stretching the trapezius muscles out. The most important thing for this is release of these trigger points. We can do that chiropractically with what we call trigger point release, or Nimmo trigger point technique, which means we're going to put just basic steady pressure into these areas. I'm going to get on that point, and I'm going to press in here with my thumb. And the patient's going to feel a lot of discomfort. But what they're going to notice is that after maybe about 30 seconds, they're going to notice it's just going to feel like the pressure of my thumb. And then what I'll do is I'll increase my pressure again. And as I increase my pressure, they're going to start to feel that pain come back again. And then in about 15 seconds, it's going to fade again. After about 3 or 4 progressions of this, I'm going to be in here where they're just going to feel the pressure of my thumb. What we're doing is we're releasing that muscle. What we call is we're getting into the belly of the muscle, which is the center of the muscle between 2 ends of the tendon. And when we put pressure in there, we're actually causing that muscle to fasciculate and then release. So we can actually, by doing ischemic compression in here, actually cause that muscle to shut off and relax. What I tell patients to do at home is a good little trick we can do. I tell them to get a tennis ball. Now, this isn't a tennis ball, but this will do for now. And what they can do is they can actually, these points that are up here in their head, where they cause a lot of headaches and pain underneath here, they can just lay on this tennis ball and put it up there and just massage and do that pressure at home. And that's one little trick they can do at home, as opposed to always looking for a massage or having people press in there. And they can lay on a tennis ball, periodic points through the air periodically throughout the day, and causing that pressure and allowing that muscle to relax. Another thing is ice cube massage. Ice cube, just put Dixie cups in the refrigerator, fill them up with ice, and then what we're going to do is we're going to do ice cube massage for about 2 to 3 minutes over each area. That's another very, very helpful thing. It helps control inflammation, it helps relax that muscle spasm, and it really helps relieve pain because it'll numb you up. And of course, like we said, just getting a massage. Going to a massage therapist, finding a good massage therapist who's experienced with this, and getting good trigger point massage, trigger point release, therapeutic deep tissue massage. Those are a few things we can do mechanically to help the patient and help relieve these symptoms. And then we're going to go over to Dr. Golding, who's going to talk about the acupuncture portion of this, because acupuncture, chiropractic, and massage are basically the 3 major conservative ways that you're going to treat fibromyalgia in a physical manner. And then after that, we're going to talk about just a couple exercises and things we can do at home in regards to what's the best for you and finding that happy medium about exercise and what you need to do each week.
Okay, you have the chronic muscle pain. You go to your family doctor, he gives you what he does, the medication. You go back, you have the testing done, you have the blood work done, send you to the rheumatologist, send you to the orthopedic specialist, then you finally end up with us in our office. You still have the pain, and we do the chiropractic work. We give you a home therapeutic program that is inclusive of stretch exercising, proper trigger point techniques, certain massage techniques at home. We try to balance your internal body chemistry so that we can get rid of inflammation naturally using diet and nutrition. You do the hair analysis. We check for toxicity, which it can also be a component of having this. And all of that's helping you, but you still have some of the problem left. So then what do we do next? What do we do about it? Now is when we consider acupuncture to be a component within the treatment to help remediate the condition. Acupuncture is the use of single-use disposable sterile needles that we're going to insert into the musculature so that we can finally release the overtension that is allowing this fibrous condition to get a hold and make the condition gradually go downhill. Now we have the muscle, and then we have the nerve that comes to the muscle. Where the nerve goes into the muscle is called a motor point. Motor points and trigger points, or these tender areas, are slightly different, but frequently they correspond. Then what we also have is that the nerve sends a signal into the muscle, and this nerve signal sends a wave effect into the muscle, causes the muscle to contract. Within the muscle are specialized cells. They're called spindle cells. They're like little springs, and these mechanical apparati within the muscles determine the normal tonus of the muscle. So what happens is that with this condition of fibromyalgia, the spring gradually gets tighter. So rather than the muscle being in a relaxed state, now is not necessarily in spasm, but is hypertonic, meaning tight and tight and tighter. And that's the way in which it stays. And what happens is you try to exercise it, you try to stretch it, it never seems to get outside this range. It feels good to get it massaged because it gets all the toxins out of the area, but it never really relieves or eradicates the condition. 2 or 3 days later, you wish you had the massage again and stuff like that. What acupuncture is going to do is it's going to reset these cells, these spindle cells, to cause them to elongate. As these cells then elongate, the muscles then finally relax. So what we're going to do is a technique that is a combination of traditional Chinese acupuncture coupled with the work by a Dr. Margaret Travell. She was John F. Kennedy's personal physician and developed this technique to help him with his musculoskeletal problems back in the 60s. This developed into this whole technique and approach. What we're going to do on Julaine is that we're going to do some acupuncture now into her neck. I've already started into some of the extremities to not waste any time. And we already know where her weaknesses are at. We are going to now do needle acupuncture into these regions to fasciculate. This is actually going to be called a trigger point release, the musculature into that area so that everything can become elongated and the inflammation can subside. So what we're going to do first of all is that today we're going to concentrate on two regions. We're going to do the trapezius. We're going to do the rhomboid muscles, the ones around the wing blades or the scapula. Those are the ones that give you that thing that you just, that ice pick that you wish you could get out of your back. That's what we're going to get rid of right now. Acupuncture treatment itself takes about anywhere from 30 to 45 minutes. A person, it actually doesn't hurt, and it certainly doesn't hurt me one bit. But actually, acupuncture doesn't hurt. It might be tender when I first do the needling process because, as we mentioned before, in true cases of fibromyalgia, these areas are tender just to the touch. So when I first do the needling, it'll be slightly tender, then the person is going to feel like anesthetized and very, very tranquil. All of the needles that we use, as I mentioned before, are single-use disposable sterile needles. And we're going to, now I'm sticking this needle inside of the rhomboid muscle right now. And what's happening is that I am manipulating the needle, meaning I'm not just sticking the needle in. I'm manipulating the needle so that we're rubbing along the surface of those muscles to cause those spindle cells to release. Gradually, what we'll see around there is we'll see a little bee sting, what looks like a little bee sting in and around this region. And what that is, that's called a histemic response. That's the favored response that we're looking for, and that tells us that this anti-inflammatory and releasing effect is occurring. What we could use as one indicator for when the patient has received the maximal benefit from the treatment is when those inflamed areas subside. Sometimes it could be as little as 5 minutes. Sometimes it could take an hour. I usually tell people to come into the office and allot for 45 minutes when they come in. All of this treatment is used after our assessment and everything upon which Dr. Kirsten talked about before. When will people usually see response with this? Sometimes the first visit. Usually within a few visits, a person's tracking. If a person, all fibromyalgia isn't considered equal, regretfully. Some people have it, and it's relatively mild. Some people have it, and they're disabled with it because it's pervasive throughout the course of their body. Obviously, it takes longer to remediate the condition, the more involved it is. Once a person's condition is stabilized, they may or may not need supportive care using acupuncture to keep themselves that way. We're never concerned about our next meal. We're just until we digest our current meal. So what we have to do is get the person to be pain-free and mobile again so that we can see what type of home treatment and supportive care that they can handle. Now, acupuncture isn't at this time working just on the muscle tissue itself. It is actually working systemically, and your body at this point in time is creating natural anti-inflammatories that can be measured in the circulatory system for 6 months after a single treatment. So the effect of this continues to build and have a multiplying effect as one continues to get the treatment. Now, things that we will do also, besides doing the direct needle treatment, now fibromyalgia is a condition where it could require as little as 10 needles throughout the course of the treatment. It could require as many as 50 or 60 needles. So it all depends on how bad, how pervasive the problem it is, and how many regions are involved. So sometimes there's a lot of needles involved. Acupuncture is kind of like exercise, where we do more and more work per given time, and then we extend it for longer durations of time. So it's like running is good, but if I had you run for 20 miles today, you'd probably be hurting. So we gradually work into it. So in the beginning, we're like in the romance phase, where we go at it easily, and then we see what a person can handle as they go along. So the acupuncture treatment, coupled with the stretching, coupled with the chiropractic care, coupled with the either in-office or at-home massage, coupled with the balance of the body chemistry and everything that lifestyles, that natural lifestyle and can incorporate, is what's going to bring the solution for the underlying condition and provide it and yourselves for as much relief as can be handled for this condition. Dr. Kirsten, come and join us just for a moment so that we can bid our adieu. For Natural Healthcare Alternatives, I'm Dr. James R. Golding. Dr. Kirsten, thank you for coming. And Julaine, thank you for being a part of this today. And I'm going to wish you a good time down in Texas Southern University in your nursing career. Have a good day.